When you're removing a pair of gloves, it is important to make sure that the outsides of the gloves do not touch your skin. Recognize an emergency. Check the scene. Check the person. Check the person's ABCs. If the person's breathing is okay, check the person for deadly bleeding and signs of shock. Call EMS 911. You should move an unconscious person into this position if you have to leave the person alone. Raise the arm that is farthest from you above the child's head. Place the arm that is closest to you across the child's chest and bend the nearest leg at the knee. Put your hand under the hollow of the child's neck and head to stabilize the child. Carefully roll the child away from you. Check the child's airway. If the child is conscious and able to answer questions, perform a hands-off, head-to-toe check for additional injuries. Explain what you're going to do and ask the child to stay still. Look at all uncovered parts of the body for bruises or deformities. Check the child's temperature. Ask the child to move each body part one at a time, provided there is no pain. If the child doesn't complain of pain and doesn't have signs of injury, have the child rest comfortably for a few minutes. Monitor the child's ABCs. If you see no problem, help the child stand up slowly when the child is ready. Begin the check at the head. Look and feel for any bleeding or abnormalities, such as bumps or soft spots. Move down the person's body to the neck and shoulders. Feel the ribs for deformity. Look at the person's chest movement. Both sides of the rib cage should expand at the same time. Gently press the abdomen. It should feel soft, not hard. If it is painful or hard to the touch, stop touching it. Next, check the hips. The hip bones should move together. The final step is to check the legs and arms. Feel for any deformity or swelling. First, check each leg. Next, check the arms. Check for medic alert medical identification. If you do not find any further injuries, treat the person for shock and continue monitoring the person's ABCs until EMS personnel arrive. Stand behind the person and support the person's body. Give the person 5 firm back blows. If the object does not come out, deliver 5 abdominal thrusts. Repeat the cycle of 5 firm back blows and 5 abdominal thrusts until the object comes out or the person starts to breathe or cough or becomes unconscious. Kneel behind the child and support the child's body. Give the child 5 firm back blows. If the object does not come out, deliver 5 abdominal thrusts. Repeat the cycle of 5 firm back blows and 5 abdominal thrusts until the object comes out or the child starts to breathe or cough or becomes unconscious. When you cannot reach far enough around a conscious, choking person to perform abdominal thrusts, try to dislodge the object by alternating between firm back blows and chest thrusts. Start by giving 5 firm back blows. If the person continues to choke, give 5 chest thrusts. Repeat the cycle of firm back blows and chest thrusts until the object comes out or the person begins to breathe, cough, or becomes unconscious. With the heel of your hand, deliver 5 firm back blows between the baby's shoulder blades. If the object does not come out, turn the baby face up while still supporting the baby's head and deliver 5 chest thrusts. Repeat the cycle of 5 firm back blows and chest thrusts until the object is coughed up, the baby starts to cry, breathe, cough, or the baby becomes unconscious. If you discover an unconscious person, immediately check the scene. Check the person's ABCs. If the person is not breathing normally, begin chest compressions immediately. Give the person a breath. If the chest does not rise, tilt the person's head farther back and try giving another breath. Return to doing chest compressions if the chest does not rise or there is no obvious response to the breath. Look for an object in the person's mouth. If you see an object, Remove it by doing a finger sweep. Start the sequence of 30 chest compressions and 2 breaths. If you discover an unconscious child, immediately check the scene. Check the child's ABCs. If the child is not breathing normally, begin chest compressions immediately. Give the child a breath. If the chest does not rise, tilt the child's head farther back and try giving another breath. Return to doing chest compressions if the chest does not rise or there is no obvious response to the breath. Look for an object in the child's mouth. If you see an object, remove it by doing a finger sweep. Start the sequence of 30 chest compressions and 2 breaths. If you discover an unconscious baby, immediately check the scene. Check the baby's ABCs. If the baby is not breathing normally, begin chest compressions immediately. Give the baby a breath. If the chest does not rise, reposition the baby's head and try giving another breath. If the breath still does not go in, start the sequence of 30 compressions and 2 breaths. Look for an object in the baby's mouth. If you see an object, remove it by doing a finger sweep. Start the sequence of 30 chest compressions and 2 breaths. Before assisting with any medication, make sure that you check the 5 rights of medication. Help the person to remove the auto-injector's safety cap. Tell the person to place the tip against the thigh and push the auto-injector firmly. The person should hold the auto-injector in place for 10 seconds. If an adult suddenly collapses and you are unable or unwilling to perform full CPR, do compression-only CPR.